All right, so we'll quickly look at another type of infection, another type of bacterial infection, and this type of bacterial infection is called what the plague bacterial infection. All right, so for the plague bacterial infection, you know that the plague bacterial infection is caused by the gram-negative bacteria. All right, so in this lecture is just a brief introduction to what a plague infection is. On that basis, here we have good pictures, all right, for you guys to see. All right, then we talk about a causative organism. I'm basically talking about the virulence. Okay, what are the factors that make this causative organism to be able to cause the plague infection in humans? So, looking at this picture, you guys could basically just have an idea of what a plague infection is. All right, it's called like a plague because, bro, it's looking so abnormal. All right, so it's more of like a plague on you. All right, so symptoms of these plagues include what? Acral gangrene. Then on the thighs, you might be having the buboes. Okay, so let's look at the causative organism for this plague disease. It is actually the Yersinia, okay, bacteria, and the Yersinia bacteria is a gram-negative bacteria. It is facultative intracellular bacterium. That means what? It can only reside inside. It can only survive for a long time inside the cells. Intracellular, facultative intracellular. All right. So we have it causes what? Three primary diseases. Right? It can cause what? Three clinical importance. Okay. It has three clinical important species, and these species can cause their various diseases. Okay, and these species together they can cause two different types of diseases. Then we have what the Yersinia pestis. That's the one we're basically talking about. To be specific, is like the Yersinia pestis, and this Yersinia pestis can cause what we call the plague. Okay, so now this Yersinia pestis is transmitted from rodents to humans by aerosols or flea bites. It could be that there are some insects that will bite the rodent, then come to transmit it into you, or it could be that there's what? Aerosols. Basically, it was transmitted through air. Okay. Then we have the Yersinia what? Enterocolitica. Yersinia enterocolitica. Then the Yersinia pseudotuberculosis. Yersinia pseudotuberculosis causes what? The fecal-oral transmitted type of ileitis and mesenteric lymphadenitis. Okay, so this Yersinia bacteria will basically what? When it comes to you, when it infects you, it goes straight to the lymphoid tissues because the lymphoid tissues is basically where its growth is favored. Okay, so Yersinia will proliferate in what? Lymphoid tissues when it infects you, and it will cause massive lymph node enlargement. That's what? The buboes. Okay, this buboes is as a result of what? Lymph node enlargement. You know, at the thighs, you have some lymph nodes that if you have any swelling, they'll be paining you. All right, so these lymph nodes will enlarge, and that's what we call the buboes. It can also cause pneumonia, it can cause sepsis, all right, also with massive bacterial proliferation. All right, so basically, this bacteria will grow so fast. Okay, it can also cause tissue necrosis, and it can cause neutrophilic what? Infiltrates. Okay, so you can see this is basically just a selective Yersinia agar. That's like the culture medium. In case you want to like grow this microorganism in the laboratory, this is how you go about it. All right. So for the plague infection, now let's look at the virulence. Okay. Virulence is basically like you looking at the factors that make the microorganism to be able to cause this disease condition. All right. So virulence factors include the following. This Yersinia, that's a Yersinia pestis, has what have what we call the Yersinia toxins, also called the UPS. Okay, so now these Yersinia toxins are injected into the host phagocytes by a syringe-like mechanism. All right, and these toxins will basically will block phagocytosis and cytokine production. So now these microorganisms will now be proliferating in your body without being killed. because of this Yersinia toxins that was injected into the phagocytes. All right. Then it also has a biofilm that obstruct the flea gastrointestinal tract, forcing it to regurgitate before feeding, and then ensuring infection. Okay. This flea, okay. The gastrointestinal tract is not your own, it's that of the flea, right? So there's a biofilm that is obstructing the gastrointestinal tract of the flea. That's if you are to get this plague infection through insect bites. That's by the flea insect. Alright. So this flea insect, when they bite you, they regurgitate. They take in what they want to take, but they regurgitate into you. Alright. Therefore, passing the microorganism, which is what the Yersinia pestis. Okay. So just you can see it from rodents. The fleas can what bite the rodents, then from the rodents it can bite the humans. Okay, so types of plague, we have the bubonic, that's most common, flea rodents to human transmission. We have the septicemic, that's secondary to bubonic or enters through breaks in your skin. Then we have pneumonic, which is what most deadly, and this is mostly what human to human transmission through air droplets. If you go close to somebody that has it and the person is talking, you might just pick it up. All right, so guys, that's it about what the plague bacteria infection, which is caused by what Yersinia pestis. So that's it, and bye for now.